I'd like to thank the panel that's here tonight, the nurses from Mather Hospital, John Benza from Outreach House. We have a parent with us tonight, and we have some students from, thank you for being here, we appreciate that. We have a problem, all right? It's not unique to us, but like my mother used to say, I don't care what everybody else does, Joe. And we're worried about our kids here. Your child knows somebody that's compromised with drugs. No question. Your child may be using drugs. Every family knows somebody. Every family has a family member who knows somebody that has a problem. We have people here who are professionals and who know professionals. And now we're partnering with Mather Hospital. We've had a long relationship with Outreach House. John Benza is a parent in this community besides being a director at Outreach House. It's the best adolescent drug rehabilitation center, I think, anywhere, certainly in New York State.
Last year, for the 2012-13 year, there were about 270 cases, drug and alcohol related, seen at Mather Emergency Room. Of those 270, 70 were from the zip code alone. It's pretty overwhelming. That's one hospital. We have 3 in this area. So if you take a look at that, we're talking about 210 cases in 1 year. So it's pretty alarming.
When do I take the next step? What's typical adolescent behavior? What's not? And in all the years I've been doing this, you know, that's a great line. And I guess if you take anything out of this tonight is that's what we need to have that conversation. You can read the statistics. The one that jumps out, our seniors. 90%, 89% of our seniors in the 30 days prior to this survey said that they have had alcohol. 50% had what they called heavy drinking, 5 or more drinks in one setting. That's our seniors. And the marijuana statistics are there too. If I go to this meeting, if I show up in the auditorium tonight, I'm identifying myself or somebody in my family or somebody I know is having a problem. And the students here know that I'm pretty comfortable sharing. I come from an addicted family. I had 2 addicts in my family. One got help, one died an active addict. But when I was 17, that was not something I spoke about. In my 35 years, I have not worked with an opiate user who woke up using opiates. They woke up using the alcohol and the marijuana. Alcohol is still the leading cause of death among adolescents. It is 6 times more deadly than all other drugs combined. And as early as 7th grade, they're at parties. And they are commenting. Because they go, it's psychological. I have willpower. I can stop. I said, well, Mark Twain said the same thing about his addiction, tobacco. Because I quit tobacco anytime I want. I've done it 6 times already. We're going to see in Colorado, we're going to see in other states where this experiment with legalizing the marijuana leads us. Already I've heard that the DWI, or the driving under the influence, is up almost 6 times the amount in Colorado. Started with what is typical adolescent behavior and what isn't.
Some of you may be sitting here thinking, I need help. Some of you may be too embarrassed. There's ways to do it where you can remain anonymous, you can keep your privacy, but you need to reach out, and reach out soon. Okay? The kids get the message all the time. So I'm not really talking to kids, I'm talking to parents. The kids know, they know what's bad, they know what's good, they know what's going on. It's the parents who are sometimes saying, there's no problem here, we can fix it, it's really not that bad, they'll outgrow it. I can only tell you those are my thoughts too at one time, and it didn't work out. So if my words could be of any help to you at all, please just reach out for help. Don't be afraid. Take that step. Take it for your kids. Take it for yourselves. Thanks for listening.
You know, when I first started hearing about the legalization of weed, that's a bad idea. Because, you know, when you lower the bar and you lower the standard, people keep going lower and lower. And everybody wants to get real creative. A better delivery system, a better way to get high, a better way to use the weed. I've had a couple kids in my private therapy practice who were the first kids that I've heard about using this thing called dabs, wax. What crack is to cocaine is what dabs is to weed. If somebody's smoking a dab, you can see them actually putting the dab of wax onto a modified bong made just for wax. Challenge is that nail's got to get pretty hot, right? And you can't use just one of those little hobby torches. You need a big torch. Not exactly something you want to be doing when you're already high, to heat up the nail. And what kids were doing, where they were modifying some of the e-cigarettes with the little coils inside, so you could open it up and put a little dab of wax inside of it. The wax is between 70 and 90% THC. It's pure THC. Pure THC. Grenco science. Check your kids' history. Just see if they've done the Grenco science. I trust you, it's not for the science project at school. Absolutely not. They've been to Grenco science, they're looking at G-pens. G-pen is kind of the standard for smoking wax. This wax weed, this dab weed is going to be a problem. You know, with alcohol, one of the big challenges is why, you know, we talk about alcohol and nicotine as illegal and lethals. It's not just the deaths that are associated with alcohol, it's the accidents. And the ER can talk about how many accidents come through with alcohol, right? Well, when kids are smoking THC at 70 to 90%, they're going to be falling, hitting their heads on stuff. I hope they're not getting behind the wheel of a car. But yeah, you know, we're going to legalize marijuana now, right? It's not what happens to us in life that's going to hurt us the most, it's how we respond or don't respond to it. If you think it's drugs, put your hand up. Make a phone call. Ask for help. The school is a great place to start that process. You get an idea that something's going on with the kid, start with a productive conversation with them. Don't turn it into a typical kind of losing your poise. Just ask, try and understand. At the same time, if you're still not sure, monitor them a little bit closely, right? Set tighter limits with them and begin the process of reaching out for help.
I'll tell you a story about a young man that came through our emergency room, was admitted to the critical care area. He was admitted there because when you're in jeopardy of maybe losing your airway or having any other kind of cardiac side effects from the drugs you've taken, you know, you're admitted to critical care. He came to critical care, he was sobered up, if you will. He went to the medical surgical floors, he was observed there, he was discharged. And prior to his discharge, the social worker did come to see him and told him, don't go out there and do what you just did. Because guess what, you're sober. Your tolerance level is much lower now. Well, he went home and he came back to our ED in 15 hours and he was dead.
Reach out to somebody. Somebody's here, somebody can guide you. They know who to contact. We'll all work together to try and make sure that, you know, all of our kids, because believe me, they're at our graduation, and they're their kids as well.